Welcome to episode 1 of Ubuntu Beds. Today, I'm really pleased to welcome Dr. Richard van Zyl-Smit onto our show. He is the Associate Professor and Consultant Pulmonologist at Groote Hospital, as well as the head of the Lung Clinical Research Unit at UCT Lung Institute, and also the head of Smoking Cessation Service, which is called the Quit Clinic here in Cape Town. Ubuntu Beds is a platform that unites healthcare workers with accommodations around South Africa, especially during the time of COVID-19. Thank you so much, Richard, for joining us.
Absolute pleasure.
I founded Ubuntu Beds about 2 months ago after finding out that I had a coronavirus myself, which was quite an interesting and eventful few weeks of my life. And after speaking to a doctor in Lombardy in Italy and asking what he would have done 2 weeks ago, he replied, I would have organized accommodation for healthcare workers who are struggling with sleep deprivation and exhaustion and burnout after doing such long hours in the hospital. Now, of course, during those times, Lombardy was the epicenter of the coronavirus. And really, I thought like a worst case scenario of where South Africa could get. Coming from hospitality myself, I thought this is something I could get involved in. So we launched the Ubuntu Beds platform. I'm really interested in your perspective and what your thoughts are around coronavirus, especially with regards to healthcare workers and the impact in general on the lungs, etc. From what I understand, coronavirus is unusually aggressive to our lungs and dangerous for those with existing lung conditions. Why is this, and what actually happens to your lungs?
Okay, so let's, just to start with the simple things, in terms of viral infections, we all know about influenza. So that's the influenza virus. So your common cold is not influenza, it's a common cold. Influenza, severe influenza, is the influenza virus. And that's what we see each year. We have the flu pandemic, and that comes out. And you may have heard of the H1N1, which was swine flu. So that's all influenza. Coronavirus is a different type of virus. And there have been 2 previous outbreaks, SARS and MERS, both of them in the Middle East. SARS got through to the US as well. And so this is a coronavirus, which is different from influenza. And this particular coronavirus is associated with severe acute respiratory distress syndrome, or otherwise known as ARDS. We saw the same with SARS and MERS. They were far more dangerous in that they killed patients much quicker, much faster. But patients that were not symptomatic didn't seem to transmit the virus. And so the problem that we have with coronavirus is that there seems to be transmission before symptoms. So the infectiousness is different. But thankfully, at this particular point, although it's bad, it doesn't seem to be as bad as SARS and MERS. So what it does is that it gets into the body through mucous membranes, so nose, eyes, and mouth, and then primarily causes inflammation in the lungs. And so the lung has 2 jobs. One is to get blood through and oxygenated, and the other is to get carbon dioxide out. And so what we see is that the virus impacts on the ability of oxygen to get into the blood system, both because the little alveoli, the sacs where the air oxygen gets into the body, are affected, as well as affecting the blood vessels. So it's almost like a double hit to the lungs. And so what we see is patients who are profoundly short of breath because they're unable to get oxygen into the blood. Now, if you had a normal pneumonia, putting you on a ventilator would help significantly because being on a ventilator would add enough oxygen. What we're seeing with coronavirus is when you hit the really severe disease, that ventilation doesn't unfortunately increase your ability to get oxygen into the blood that much. And so although the majority of patients who get coronavirus will survive, there is a small group who are profoundly unwell, who are in big trouble. And that's obviously where we come in from the hospital side, is we having to look after that. But thankfully, that's a small percentage. But when you've got 70 or 100,000 patients getting infected in a couple of days or weeks, even a small percentage of a couple of 100,000 is a large number of patients in the hospital.
My next question is around tobacco and smoking. So South Africa has prohibited the sale of tobacco or cigarettes since the lockdown. Why do you believe that this No Smoking Act has been brought in? And what about vaping? Also, you know, if you do smoke, what do you recommend to individuals regarding smoking and coronavirus?
So Kim, the smoking situation is highly controversial, and you will have seen, I'm sure, in the media, many groups and people complaining about it, lawsuits coming in, government defending. And so I don't want to get into the politics thereof, because they are both very complicated and can be quite heated. And I'm sort of in the middle of it, although not entirely. The premise for the ban of smoking, I was not involved in any of those discussions, so I can't tell you why the government decided. However, what I can tell you is that smoking is bad for the lungs, end of story. And there's good evidence that if you smoke, you have a higher risk of getting tuberculosis, you have a higher risk of getting bacterial pneumonia, and you have a higher risk of getting influenza. The issue of whether you are at higher risk for coronavirus infection, so this current COVID-19 outbreak, if you smoke, are you at higher risk than non-smokers, is unclear at this point. It's early in the science, it's early in the epidemic. It would make sense that you are, but we cannot be conclusive one way or the other. The other issue with smoking is that it's a social activity. And I mean, the minister's been quoted as saying is when you lick your cigarette and you roll it and you hand yours all over to someone else. So as much as she's been poked fun at for having said that, that is true, that there is sharing of cigarettes, that if you have a cigarette in your mouth and you pass it on, the chances are that you could pass the virus on as well. And people tend to be social when they smoke. Now, whether or not that is a good or bad reason to ban tobacco, I don't wish to get into. And whether or not smoking is an increased risk for coronavirus or not, I think is probably a moot point, except about the ban. Having said all of that, if you smoke, you have significantly higher risks for all sorts of things. And so, and I've been quoted as saying this before, now is a fantastic time to give up smoking because of the potential risks. But it's a terrible time to give up smoking because those that smoke often smoke for good reasons and not infrequently being anxious or depressed or worried or bored. And this is a perfect time to be anxious, depressed, worried, or bored. So although it's a perfect opportunity, it's a terrible time because society is in complete upheaval and many people smoke for that reason. So I feel quite sorry for smokers because of the extra cost that they are incurring because of their cigarettes. I'm not advocating that they should be smoking, but I also recognize as running the smoking cessation service that it is a difficult time. But I think smokers would be well served to spend money on quitting smoking rather than spending money on buying cigarettes, but that's easier said than done. In terms of vaping, there is absolutely no data. From our published work, vaping is not completely harmless. There are mechanisms that we have distinguished that are different from smoking. We've demonstrated risk for pneumococcal pneumonia with vaping. And so it may be a less harmful, quote unquote, but it's certainly not harmless. Yes, if you wish to vape as opposed to tobacco smoking, you may be slightly safer, but that's really based on zero data.
So what are your thoughts around sleep and the coronavirus? So how important is sleep during this time? So first of all, for healthcare workers in particular, for COVID patients, but for the public in general. I know that when I had corona, one of the first things my doctor said is just rest a lot.
If you have influenza, those that have had bad flu, you will know you are absolutely exhausted. The virus is essentially all through your body. It's not just in the lungs. Your body is fighting this infection. And so sleeping, eating, drinking fluids, all of those kind of things is normal and should be what you should do when you have a severe viral infection. Whether or not you need more sleep with corona than with severe swine flu is up for debate. But certainly rest is vitally important. When it comes to the healthcare workers, there's been a lot of talk in the media and to suggest that healthcare workers or insomnia is a particular problem. And I think it's a problem for two reasons. One is if you don't sleep, you don't recover well. And so just generally keeping yourself healthy and fit, not being able to exercise is a problem, not being able to eat well is a problem. So it's part of just general sustainability. And the insomnia is, as I said, very common and probably a combination of just general heightened anxiety. So everybody in the country, in the world, has a degree of heightened anxiety. And in that anxious state, everything is more awake. All your systems are in that sort of fight and flight kind of mode. And so it is more difficult to get to sleep. And from someone who's working in the COVID intensive care unit at the hospital, you work flat out all day. And although I get to go home at night and other staff stay in the hospital, it's very difficult to switch off after a very, very intense day. And, you know, for those in other industries, just think of a normal day where it's been utter chaos at work, where everything has gone wrong that possibly can go wrong. When you get home, to try and go to sleep is almost impossible because your brain just keeps getting woken up and you're going round and round in circles. And then also the healthcare workers, particularly those of us that do our calls from home, are often getting phoned throughout the night. So there is, I think, an element generally when you're not necessarily in the front line, there is this heightened anxiety and concern. And certainly when you're working, none of us have ever seen anything like this. This is far more than we have experienced before. We're still on the ramping up phase. The peak has not hit, but the hospital teams are exhausted already, and we haven't even got, as I said, to the peak. So it is a major problem and not easily solvable.
What are your thoughts about public transport in South Africa? As we know, many workers and healthcare workers use the public transport system, which is limited at the moment in its operating times, but also quite close. People come into quite close contact with one another, especially at the ranks and the interchanges, etc. What are your thoughts about that?
Yeah, I mean, social distancing is the major way of stopping transmission. Even again in the hospital, we don't have tea or sit in the lounge together anymore. You sit on opposite sides of the tea room and you have two people in the tea room. So our normal social congregation as humans has been disrupted. You don't wish to transmit between individuals, so you have to stay away from each other. Taxis, buses, trains are a major problem because they are designed to be mass transport. And the majority of staff working in hospitals are reliant on public transport. And so it is a problem. We've seen several staff now get infected. And the question is, were they infected at home or in transport, or were they infected at the hospital? And at the hospital, we are particularly particular about our personal protective equipment because we can protect ourselves. In the taxi, if you're the one wearing a mask and no one else is, there's not a whole lot you can do about it if that's the last taxi you need to take. So it is a problem that people need to be moving around town. And certainly the limitation on number of people per taxi, I think, has been correct. But it doesn't compare in any way to someone like myself who can get into my own car and sterilize it and get out my own car with no one else in it. It is a major problem.
I think it probably also adds to that anxiety as well. Perhaps even just I find myself being very anxious in public crowded spaces, even though I hope that I'm to a degree immune, at least for a few months. My heart rate level really does go up when I'm surrounded by people who, in tight spaces. So, as you know, Ubuntu Beds is signing up healthcare workers around the country And we're seeing the numbers increase every week, which is really encouraging to see people reaching out to this resource. A lot of them are preparing for, you know, they're describing the calm before the storm at the moment, and they're preparing for when that peak hits us. You know, many of them need the rooms because they live with multi-generational families. So for example, perhaps they live with their parents and even their grandparents under one home, and they're concerned because, you know, their loved ones are vulnerable, perhaps they have a lung disease or cancer or similar. And in South Africa, I think we've had now over 500 healthcare workers contracting COVID already. What do you think the impact is of initiatives like Ubuntu Beds in stopping further transmissions?
It's been a concern for all of us right from the beginning, and we've had discussions in our team as to what we're going to do when, you know, when it hits. You know, simple things like, so you can see I'm wearing my bright green scrubs. I have hospital clothes and I have home clothes. So I change at work and I go home in different sets of clothes. I have the ability to do that. And so we make sure that we, in a sense, decontaminate before we get into our house. That's easy. As you mentioned, the problem is living in a household. Certainly the range of complexity of living in a single house with 2 rooms and 5 family members, all the way through to living in a mansion where you can lock yourself in the granny flat downstairs or separate yourself, still has challenges. So I think it's a challenge across the board, but certainly for the majority of staff, the ability to isolate at home is a major challenge and a concern that I will potentially infect my family. We've had discussions about where I'm going to be sleeping if I should get symptomatic, and whether I'm going to put myself in the spare room or put a mattress in my lounge. So those discussions certainly are happening. The challenge is that we are all social beings, and to, in a sense, lock myself away from my family for a month is just going to add another insult to injury where everything's going to be on Zoom. But that's got to be balanced up with the risk of my family and me potentially infecting them, or vice versa. It's not only the healthcare worker that brings the risk into the family, it's the family who potentially will infect the healthcare worker, who will then infect their colleagues. So it works both ways. And again, I think several hospitals and facilities are looking at options for staff to not have to travel, for staff that need to self-isolate, and for staff who are infected as to where they go, rather than going back home and increasing the community spread. So it's a difficult situation because we're balancing our natural social wanting to be with our family and the support that we have, but also in terms of not infecting them or being infected in our households.
I think that's one of the main reasons why I think that there may, and hopefully not, be a tipping point where, you know, where conversations we've been having with healthcare workers is like, oh, there are 2 COVID patients in the hospital at this point in time, or there are 3. And in many cases, the staff are able to self-isolate within the hospitals. And that's been, you know, in the period of stage 5 lockdown where elective surgery was not allowed. And so that's, we've seen that quite a lot. And I think that the next few weeks are going to be interesting and challenging, I believe, for the medical community as we start seeing numbers ramp up. In closing, what are your thoughts for the next few weeks, if you could look into the future?
The crystal ball has 2 sides to it. One, we've seen New York, we've seen Italy, and it looks like we're following the same pattern. The other side of the crystal ball says we've done so well in South Africa, and South Africa is unique and different, and maybe we can do this differently. But I think in reality, and oddly enough, I think as the lockdown goes to stage 3 at some point, hopefully in the next week or 2, as the rest of the country comes out of lockdown and can go back to work, the healthcare sector is only going to start ramping up, which is very different from where we've seen elsewhere. So like Italy and New York locked down at the middle of their chaos. We locked down before to give ourselves time. And in a sense, we're unlocking just before the peak. So there may be a collective sigh of relief in the public where they can buy their alcohol, potentially their cigarettes, and go shopping again. But in reality, for the healthcare sector, we're only going to really start working. Not that we aren't already. We're already going flat out, but it's going to be a lot worse.
Thank you so much for sharing your thoughts and your knowledge with me. I really appreciate it. And good luck for the next few weeks, and good luck to your team. We hope to see you in one of our Ubuntu Beds hotels soon if you need it. Thank you, Dr. Richard van Zyl-Smit. It's been great talking to you.